welcome to Beginner's E-Corner channel. So now in this video we're going to witness on how to do the Caplin bandage, or otherwise we can call it as the recurrent bandage. To perform this we have Miss Sanya to do the nurse role and we have Miss Mirnalini to do the patient role. So over to you, the session starts. So to start on with the Caplin bandage, you're going to go with the simple circle turns. As we saw, all the bandages to be started with 2 simple circle turns, and once you fix the bandage with the 2 simple circle turns, then you're going to go with the after this is fixed, you're going to come forward. So when you fold on to the front, you are going to go in the shape of a V pattern, and it should be going on to a crisscross fashion. Again to that side. Yes, overlap over here. Then if the bandage roll has got over, then you have to continue. So as this roll has not yet completed this side, so you are going to finish the bandage with 2 simple circle turns and then fix it with the adhesive plaster. So you can finish it. Very good. So this is how a Caplin bandage looks like. So if you have done it in a right technique, you can just look it over. So it's going in the V pattern, crisscrossing, front and fold. So you call it as the bandages going on in a recurrent way. So we call this as recurrent bandage, or otherwise you can call it as a Caplin bandage. So I think you are all clear now by this type of bandage. I've done the bandage very perfectly, so you can just open up and just check out it should be in the shape of a cap. So to continue on, we have the next bandage which is going to be performed by Miss Neeta and Miss Frenebin. Frenebin will be acting as a patient and Miss Neeta will be acting as a nurse. So what bandage are you going to perform, Neeta?
Eye bandage.
Okay, start. So as we saw in all the previous videos, you are going to start on with 2 simple circular turns starting from the forehead. So finally you'll be fixing it with the plaster. So this is how the eye bandage gets completed. So the full eye must be covered, and it's not going to cover the ears. So the ears are left around, and you can also see it is covering, not uncovering the other eye. So this is clear with eye bandage, I think so. Over to the next bandage. We are going to witness on the ear bandage, which is going to be performed by Miss Sona, acting as a nurse, and Miss Neeta will be the patient for us. Over to you. Similarly, as we saw in the previous videos, you are going to start with 2 simple circular turns, fixing the forehead, and then you will be starting on with the ear bandage. So whichever ear is affected, that ear alone you will be covering with the dressing. See that you are not covering the eyes, which is dominant very close to the ear. So once you finish, you are going to fix it with the adhesive plaster. So here you can witness how the ear is fully covered, not covering the eye and the face. So this is how you perform the ear bandage. So hope you are all now thorough with the different types of bandages. Please stay tuned to go on with the new session of new videos. Thank you all for watching. Thank you for your patient listening.